So I was talking about vasectomy. I don't know if you have heard of the word vasectomy. If you are joining my life, you are welcome. Do wait to subscribe. Don't just go without subscribing. So some persons don't have idea that there are birth controls also for men. You understand? Some persons don't even know because it's something that we don't talk much about. There's not much awareness about this form of birth control for men. Because when it comes to birth control, the major focus is on women. When it comes to birth control, the major focus is on women. They don't talk much about men birth control. So another form of men birth control is vasectomy. Now, you have to understand that vasectomy is a medical procedure, is an invasive procedure where a surgery will be taking place. Now, you have to understand that the testis is where sperm is produced. Sperm is produced in the testis, then it is transported to the epidermis, where it is stored and is allowed to mature. You understand? Where maturation of sperm occurs or happens. Then after maturation, then it is stored until maybe arousal or during sexual intercourse or during ejaculation. Now, during ejaculation, the epidermis contracts and this sperm is transported through the vas deferens. The vas deferens is like a tube. Its major work is not to produce sperm. Its major work is to transport sperm, not to produce. So it is what connects the epidermis to the ejaculating duct where it's ejaculated. You understand? Where sperm is ejaculated through the urethra. So this vast difference is just like the fallopian tube in women. It is two vast different, just like the fallopian tube in women that helps to transport the egg, that allows the egg and the sperm to meet for fertilization to occur. Without the fallopian tube, it can be ovulating every month. Your body will be releasing egg, but yet you can't conceive. There will be no fertilization because of the fallopian tube. If there's no fallopian tube, you understand? So this fallopian tube is just like the same thing as vas deferens for men. So now the vas deferens is a tube that transports sperm to the ejaculating spot dot where it is ejaculated out. Now in vasectomy, this this vas deferens, which is a tube, they cut it off. Either they tie it or they cut it off so that it does not connect or it does not transport sperm from the epidermis to the ejaculating duct. And when this happens, sperm cannot be transported. So you might be curious to ask, a man that has gone through vasectomy, can they still ejaculate sperm during intercourse? Ejaculate semen during intercourse? The answer is yes. A man that has undergone vasectomy can ejaculate semen, but there will be no sperm there. You understand? There will be no sperm there. Vasectomy does not prevent a man from having sexual urge. It does not prevent sexual strength during intercourse. It does not reduce libido. It does not stop erection in men. It does not reduce anything like men muscularity. The only thing it does is that it disconnects the tube that carries sperm to the ejaculating duct where it is ejaculated out. So vasectomy does not prevent the production of sperm. You need to get that clear. Remember, sperm is produced in the testes. It is stored in the epidermis where it is matured and stored. You understand? So it does not prevent the production of sperm. Someone that has undergone vasectomy can still produce sperm, but just that it cannot be ejaculated out because the tube is cut off. The tube that connects it to be ejaculated out is a procedure where they tie it or they disconnect it, because during arousal, during arousal, when there is sexual intercourse, During arousal, during ejaculation, the epidermis contracts and sperm is transported from the epidermis to the vas deferens, which is the tube that transport the sperm out to the ejaculating duct, then through the urethra. Now, the vas deferens does not produce sperm. Its major work is to transport sperm. So that is the major thing that they cut off during vesectomy, and it's one of the safest birth control method. You understand? It's a safe birth control method without any side effect. You don't have to worry about any side effect. And further enough, this procedure is very, very easy. It's not something that they will give you hospital beds to stay in the hospital. So it's a procedure that you walk into the hospital within 15 to 30 minutes. The surgery is done, and it's not painful at all. It's not painful at all. You understand? It's not painful at all. Just that after the surgery, during the surgery, they will give you local anesthesia. If you understand what local anesthesia is not like general anesthesia. In general anesthesia is where they numb the whole part of your body. They give you injection to numb the whole part of your body so that your brain will not receive signal of the pains. You understand? Because it's the brain. The nerve transports pain signals to your brain, which respond. Then when the brain responds is when you start feeling those pains you normally experience. So during anything anesthesia, you understand, they numb those nerves. General anesthesia, they numb the whole part of the body, while local anesthesia, they only numb that particular place they want to operate. So in local anesthesia, the patient will be awake during the surgical operation. The person will be awake, will be aware of everything, but just that particular spot, you will not feel pains because they give you drugs to, will I say, so that you will not experience any pain. They call it numbing. They numb that area so that you will not experience pain, like block those nerve signals that sense pain signals, because we have brain pathways that send pain pathways that send those pain signals to the brain. So after this surgical operation, it's not something that happens immediately. After vasectomy, the man there's high possibility that it can still ejaculate sperm, like the semen can still contain sperm. So to be on a safer side, after vasectomy, they are asked to come back in 3 months. So after, they will be ejaculating, but there will be no this thing, just to be careful. They will be asked to come back after 3 months. Then during that 3 months, they will scrutinize the sperm, the semen, to check if there's still sperm inside of the semen. So some person thinks that every ejaculation contains sperm. Well, that is not true. That is why you see with some men that has low sperm count, they'll keep on ejaculating semen, but there is no sperm on it. You understand? So in vasectomy, it does not stop you from ejaculating semen. Of course, you ejaculate semen, but just that the sperm is not there. And it's that sperm that causes fertilization, because it's the sperm that swims to this thing, that swims and meet the egg, where fertilization occurs. So even if you ejaculate semen, since there is no sperm there will be no pregnancy. This vasectomy is one of the safest methods of birth control. The risk factor is low compared to women that takes so many pills, and those pills plays a role in a hormone. You understand? Like this postinone 2. This postinone 2, what it does is that it delays ovulation. So it also plays a role in a hormone. Some of these implants that women put on, some of them will not see their period for years. Some, once they see their period, they will bleed. Some will bleed for months. So it has so many effects on women. So if you are couples and you don't want to have kids again, you are done having kids, you have 4 children, 3 children, 5 children as you desire to have, or maybe you don't want anything children because you have already large family, or maybe you are in a marriage or in a relationship where pregnancy can cause a risk to your partner, which is your wife. The another method, the safest method is vesectomy. Understand? It is 99% safe. It's 99% safe, but don't do that if you are not sure of having children. The reason why I say you shouldn't do that if you are not sure of having children again in the next future, because this procedure is permanent. It's not something that can be reversed. So you have to be careful when making such kind of decision. It's not something that you can go back and say, "Hi, doctor, I want to start having kids. Can you please and do another surgery to reverse it?" It is not reversible. It is a permanent procedure. So before you do a vasectomy, you need to be sure that you already have kids. You don't want, maybe you feel like as a man you don't want kids, then you can do a vasectomy. If you have any question, you can drop it in the comment section. So this is about vasectomy, and people are not aware about it. It's another form of birth control for men. Some women go through other means of controlling birth control. So women go to the extent, for women that have decided to be child free, there are women like that made up their mind they don't want children in this lifetime, so they go for tube. Some of them will go and tie their tube, you understand. Some of them too will go and remove their womb. So it's all these things are procedures, but I won't really advise that, you understand. So it depends on the decision you want. If you are joining my life, you're welcome. Do wait to subscribe. So I'm talking about vasectomy, one of the safest methods for birth control for men. And our society don't talk much of it, because when it comes to birth control, the more focus is on women. But men can also help in birth control, particularly if you are done having kids. If you don't want to have children again in your life, you can go for vasectomy. Or maybe if you're in a relationship or marriage where pregnancy plays a risk, there's a risk factor, because there's some women that has some kind of complication in their life that pregnancy can risk their life. So doctor might want to option for that, particularly if the pregnancy occurring in such kind of situation can put the woman at risk. Vasectomy is another form of it. So one thing you have to understand is that once this procedure happens, there is no going back. It is a permanent procedure. Please, what is vasectomy? Thank you for that answer. Thank you for that question. Vasectomy is a medical procedure, it's a surgical procedure where the vas deferens, which is a tube that transports sperm so that it will be ejaculated, it's cut off. There is 2 vas deferens. It is cut off. It's a procedure where they cut off that tube. Now you need to understand that the sperm is produced in the testes. From the testes is produced to is transported to the epidermis. Now in the epidermis is where sperm is left to mature and is stored. Now during arousal, during intercourse, during ejaculation, the epidermis contracts and sperm is transported from the epidermis to the vas deferens. The vas deferens is a transport that transports sperm where it is ejaculated out. Now in vasectomy, this procedure cuts that tube, that vas deferens, cut it off so that sperm can no longer be transported out. So someone that has undergo vasectomy we ejaculate semen normally. It doesn't stop you from ejaculating semen, but just that sperm will not be there. You will not ejaculate sperm will not be there. That's why if you are confused about this, think of those men that they ejaculate semen but their sperm is low, like there's no lifespan there. So you can actually ejaculate semen, but there's no sperm in your semen. That is what happens in vasectomy. Vasectomy does not stop a man from producing sperm. You have to understand that, because the sperm is produced in the testes, stored in the epidermis. The only difference is that the tube that transport this sperm out of your body through your urethra is cut off, just like the fallopian tube. You know, we have fallopian tube in women. Now, the fallopian tube is what connects the ovaries to the uterus, and it's the fallopian tube where fertilization occurs. Without the fallopian tube, after the surgery, how many percentage of expectancy that it doesn't leak? Okay, I need to answer this now. After the surgery, you need to understand that vasectomy does not immediately happen. Like the surgery does, after the surgery, it does not immediately start working immediately. Now, doctors will give you at least 3 months, because some sperm might be already be in your ejaculating duct already. So you might be ejaculating, and there's a possibility that sperm will still be there. So they will give you a space of 3 months. After that 3 months, you come back again to the hospital where the procedure was done. Now they will run a test for you, the sperm semen analysis, to check if there is still sperm there. You understand? So after the surgery, it does not automatically work immediately. So they will give you a space of 3 months just to make sure that there's nothing left. It is 99% safe. Like, when something is 99%, you should know how the high risk it is. When something is 99%, that means that it is almost like 100% that this thing is guaranteed that pregnancy will not happen, fertilization will not happen after intercourse. Is 99%. Vasectomy is 99% safe when it comes to birth control. After the surgery, okay, it's 99% there. It doesn't leak. It doesn't leak, unless maybe the person that did the procedure did not do it well. It doesn't leak. It's 99% and is permanent. Although I've heard in some cases where it's someone that had vasectomy and still got someone pregnant. I've heard such kind of stories, but you just have to understand, in this life there is always an exception. Exception is not the rules. Good information. Yeah, welcome, please. Thank you so much. So exception is not always the rules. Even as in medical terms, where they said no baby can survive to full term in an ectopic pregnancy in women, I can tell you for sure that in medical terms, there's no baby that can survive to full term in an ectopic pregnancy, but you can hear of rare cases. This is not themselves seen it. In rare cases where a baby grow outside the womb and survive till full term, they operated and the baby is alive. So that is exception. Exception is not the rules. So in vasectomy, once you do vasectomy, there is no going back. It's a permanent procedure. It cannot be reversed. But I've heard in some cases where a man still impregnate a woman after vasectomy. I think a story like that, where a man was accusing the partner for cheating, because why would the partner give birth? I mean, why would the partner become pregnant when the man went for vasectomy, and maybe she's not aware of it? I've heard of story like that. She's not aware that the man went for vasectomy and their relationship, because the man decided not to have children. So in the process of that, the woman get pregnant. You understand? So it happens that after all said and done, the man actually was responsible for the pregnancy. That is an exception. That is not the rules. Once you undergo vasectomy, it is 100%, 99% safe. Like, it's a safest method of birth control. There's no way that you can impregnate a lady. when you undergo vasectomy, but there's always an exception to the rules. So many things that has defined medical this thing understanding, so there's always an exception, but it's very, very rare. Like I say, 1% is not enough when it comes to 99%. So in vasectomy, some people don't understand this. Vasectomy does not stop a man from having high libido. It does not affect libido at all. It does not stop you from having erection. So you have to remove that misconception that once you have vasectomy that you are not man enough. No, you have your normal erection. You have your normal, it does not reduce your sexual strength as a man. No, it does not reduce your sexual capability to handle a lady as a man. It does not reduce your muscularity as a man. It does not do any of that. The only thing that it does is that it cuts off the tube that transports sperm to your ejaculating duct. That's the only thing that happens in vasectomy. So it's the safest form of birth control for couples that don't want to have children again. So before you go undergo such kind of procedure, you have to sit down and think very well. If maybe you have a lady or maybe your wife has some medical condition that maybe she's done giving birth and she has medical condition that might affect her health when she gets pregnant, and birth control is giving her several issues. Some women, birth control give them several issues, implants give them several issues in their body. Some of them will start having different kind of symptoms, and if you have such kind of wife or woman and you are done having kids, you can go for vasectomy. Understand? You can go for vasectomy. That is another form of birth control. Please, if you have a question, you can drop it in the comment section. I really appreciate. So it makes us interact one on one, conversationally, makes us interact, me interacting with my audience about this particular topic, vasectomy. Some persons are not aware that there are birth control for men, so it makes us interactive, you understand? So drop your question in the comment below, just in case you have any question. So if you're joining my life, you're welcome. So I'm talking about vasectomy as a form of birth control for men and how safe it is. This procedure does not take time. You can just walk into the hospital when you have appointment. When next is your teaching coming up? Okay, when next is my teaching coming up? I normally come live. I can come live tomorrow, so I can come live tomorrow. At least for now, I'm a bit free, so I do come live. Anytime I'm free, I make that time to come live. Although it's not easy because I'm a very busy person, so I try coming live anytime I have the opportunity to come live. You understand? So tomorrow also we have different topics, health topics. Just go through my page. You love it. You learn a lot about these health issues. There's different things to learn. If maybe you have a wife, you have a girlfriend, at least you can just educate them on issues like this. I talk about last time I was live. I think that was a day before yesterday. Which topic I was on topic like that. I've forgotten the topic I was. Both ectopic pregnancy, a lot of things will be discussed. So for now I've made up my mind to be consistent with coming life. Understand? To be consistent about coming life. So tomorrow also I'll make a time to come live, but there's no specific time. I normally come live, so I can just decide anytime I'm free just to on camera and talk about health issues, just to educate people out there, because some persons are not really aware of all this stuff, and in this day and age it's not good to be ignorant on something that is easily accessible, information that are easily accessible. So that is it. So where are you chatting from, if I may ask? Where are you chatting from? So vasectomy is another method, one of the safest methods of birth control. So if you're joining my life, I'm talking about vasectomy for men. Vasectomy is a form of birth control for men. You understand? It's a form of birth control for men. Yeah, a surgical procedure will be conducted to cut the vas difference. Vas difference is the tube that connects the vas difference is the tube that connects the epidermis to the ejaculating duct. Now, in vasectomy, vasectomy does not prevent a man from ejaculating, does not prevent a man from ejaculating semen, but just that sperm will not be there. I know what happens. Sperm is what causes fertilization. Without sperm, there will be no fertilization. You understand? Without sperm, fertilization will not happen. So when there is no sperm, how will the woman conceive? That's why you see some men with low sperm count unable to impregnate a woman. Still, they will ejaculate as a normal man and the rest. But pregnancy will not occur because there is no sperm. Now, in vasectomy, you only release semen but no sperm because the tube that connects the epidermis where the sperm is stored is cut off. It's a procedure where they cut off that tube that connects the epidermis where the sperm is stored to the ejaculating duct where it's ejaculated out through the urethra. You understand? So in vasectomy does not stop a man from producing sperm. Oh. Of course you produce sperm, but just that it won't be transported out because the tube that transports it out is cut off. I don't know if you're understanding me. If you have any question, maybe you're curious, you can just drop your question in the comment below. Now, vasectomy does not stop a man from having libido, high libido. It does not affect your libido as a man. So this misconception about vasectomy, that's what people think, that once you have vasectomy as a man, you're not man enough, you don't have any sexual drive. What relationship do you have with a woman? Vasectomy does not stop you from having erection. You have your normal erection. It does not reduce your sexual drive. It does not reduce your sexual strength. So all these things does not tamper with it. You understand? You have your normal stuff, but just that sperm will not be there in that semen you're ejaculating. And once that sperm is not there, how will you impregnate a lady? Fertilization, pregnancy will not occur. So it's one of the safest form of birth control, particularly for couples that don't want to have children again, for couples that are done having kids. So vasectomy is one of the options for them. And it's a permanent procedure. It's something that cannot be easily reversed. So if you have any question, drop in the comment below. So vasectomy does not stop you from having ejaculation, does not stop you from ejaculating semen, but just that there will be no sperm inside that semen you are ejaculating, because the tube that connects the epidermis where the sperm is stored is cut off through surgical procedure. You understand? So how this surgical procedure happen is that they will give you a local anesthesia. A local anesthesia is an injection that they will inject, particularly that particular spot that they want that procedure to be done. So now they are blocking that nerve signals, because it's nerve that send any sensation you have in your body, like maybe if you have a cut in your body, is a nerve that send these signals to your brain. Now your brain will not interpret it. When your brain interprets it, still now out is having pains. You're feeling that sensation of pains in your body. So what local anesthesia, what anesthesia does in general, because we have local anesthesia, we have general anesthesia. What local anesthesia or maybe any form of anesthesia does is that it blocks those nerve signals so that they cannot send out that pain message. You have that pain message to your brain. When your brain cannot do not receive any pain signals, it don't feel any pain. So this is how anesthesia works. So now in vasectomy, they will give you local anesthesia to numb that particular spot that surgical operation wants to take place. While in general anesthesia is what they will numb the whole part of your body. When they numb the whole part of your body, you cannot receive pain during that particular operation or surgery. You will not receive pain because the nerves there, those medication is blocking those nerve signals that send pain signals to the brain. Because when the brain receives those pain signals, it interprets it and send it back through also a nerve. When they send it back just through also a nerve is when you start feeling that pain sensation you have. Like now when you touch a hot water, maybe a hot thing touches your skin, that is a nerve that sends the signal immediately to your brain. Now when your brain interprets it, bam, is when you start feeling that this thing pain. And it's something that happens just within minutes. No, it's not something that takes all these electrical activities of the body, electrical activities of the brain, something that happens within seconds, minutes. It's not like it takes time. So in anesthesia, they numb your body so that you won't feel pains. Now in local anesthesia, during vasectomy, they numb that particular area, which is your scrotum or your the skin around the vas different. They numb it. Then they perform the procedure and cut off this tube. Remember, vas difference is not responsible for producing sperm. Its main job is to transport sperm to the ejaculating duct, from the ejaculating duct through the urethra, where it is ejaculated out into the vagina. You understand? Into the uterus, sorry. Through the vagina into the uterus. So in vasectomy, that vas difference is cut off. So it can actually, a man that has undergone vasectomy can ejaculate semen, but just that sperm will not be inside. And once there is no sperm inside, fertilization cannot happen now, because it's a sperm that travels to meet the egg and fertilize it. When fertilization occurs, implantation occurs, then pregnancy and the rest. So in vasectomy, there is no sperm in your semen. But you need to understand that when you undergo this procedure, it does not happen immediately. So they normally advise you to wait at least 3 months, or maybe to be careful at least 3 months. Because even if you ejaculate immediately after that, some sperm can be there also. So they will ask you to wait at least 3 months. Then after 3 months, they will also ask you to come back to the hospital. Then they will examine your semen. If there's still sperm there, they will examine your semen if there's still sperm there. And you have to understand that this procedure is permanent. It's not a procedure that you wake up in the morning and just want to do a vasectomy. It's not something you can reverse. Once you do vasectomy, it is permanent. It's not easily reversed. I don't know if they normally reverse it, but my research, it's a permanent procedure. You understand? It's a permanent procedure. They don't reverse it. So that is how it is. So before you do anything vasectomy, you need to be sure that you don't want children again. Either you are done with having kids, or your family is already complete, don't want children again due to finance, or maybe you just want to be child free. Some persons might decide to be child free in their life without wanting children. How effective is vasectomy in preventing pregnancy? Thank you for that question. Vasectomy is 99% safe. In fact, it's one of the safest birth control method. It's 99% safe when it comes to preventing pregnancy, and there's no risk involved. Like, the risk is minimal. Let me not use the word there's no risk involved, because there's no medical procedure where there's no risk. The risk is minimal. Like, you will not start having issues like women that once they have implants. Once they have implants, some of them will not see their period for months. Even when they start seeing their period, they bleed and bleed and bleed and bleed. So that is how it is about vasectomy. It is 99% safe. Now, if you want to go for a permanent birth control and you are done having kids, vasectomy is one of them. Although some women take other options like tying their womb. Tying their tubes. There's some women that does it once they don't want, even the ones that decide to be child free by choice, they tie their tube. I know what that happens. Fallopian tube is what connects your ovaries to your uterus. Without the fallopian tube, fertilization will not occur, and the fertilized egg will not be transported into the uterus. So they go as far as tying their tube. That's another form of birth control. You understand? Why some women will go as far, but I'm not advising this. Some women will go as far as removing their womb once they are done having children. How long after procedure should I use another form of contraception? How long after procedure should I use another form of contraception? Okay, thank you for that question. After procedure, after the medical surgery, it's not immediately. You understand? It does not happen immediately. At least they wait for a span of 3 months. So during that period, you can decide to use condom with your wife or your partner. Can you decide to use condom, or maybe you can option for emergency birth control, which is Postinion 2. Postinion 2 is a form of an emergency birth control where you take a pill within certain hour. So what this Postinion 2 does is that it delays ovulation so that sperm will not meet the egg. You understand? So Postinion 2 is not something that they take every time you have sexual intercourse. So women don't know this. You don't take Postinion 2 every day. You have, maybe you met a guy today, you take Postinion 2. You met another guy tomorrow, you take Postinion 2. Just to prevent pregnancy. It's not done that way. Highest once in a month you should take this drug. It delays ovulation. You understand? But if you're already ovulating during this period, maybe you met your husband, your partner, and you're already ovulating, Postinion 2 will do you no good. It will do you no good, because the ovulation has already happened. So what is it just doing again? So what Postinion 2 does is that it delays ovulation. And when it delays ovulation, fertilization will not happen now. So for the vasectomy, you can use emergency birth control pill during that first 3 months. You can use um condom just to prevent in pregnancy, or maybe you can just avoid meeting a woman in her fertile period, or maybe you can try withdrawal method. This all these forms are also another form of birth control. So after that 3 months, you go back to the hospital, they check you and see if there's still sperm in your semen. I don't know if you understand. If you have any other question, you can drop in the comment section. You need to understand that vasectomy is not a painful procedure. So it's not like some kind of surgery that you have to wait for months before you recover. You can even go to work the next day. You understand? It's just a minor surgery, simple surgery that you do and go on your way. You can walk into the hospital, get the surgery, and go home. So they don't give you sick bed. So that is how it works. It's one of the safest method of birth control for men. Please, if you are joining my life, you're welcome. I'm talking about vasectomy, and it's a form of birth control for men. You understand? Now, you have to understand that, again, you have to understand that vasectomy is not the same thing as castration. This is what people don't understand. Vasectomy is not, vasectomy, sorry, is not the same as castration. Now, in castration, the testis is either removed or chemically shut down. You need to get this right. Remember, the testis is what produces the sperm. Now, the sperm is transported to the epidermis, where it is stored and mature. Then, during sexual arousal, it contracts and is transported into the tube, which is the vas deferens. Vasectomy is not the same thing as castration. In vasectomy, the man can still produce sperm. It does not stop the man from producing sperm. It does not stop sperm production. But the difference is that sperm cannot be transported out because the tube that transports the sperm out is cut off. While in castration, you have to understand this difference. In castration, the testis which produces the sperm is either removed or chemically shut down. Now, you have to understand the two difference so that people will not misunderstand. People normally misunderstand castration and vasectomy. They are not the same thing. In vasectomy, the body can still produce sperm, it doesn't affect sperm production. While in castration, there is no sperm production because either the testis is already removed, which remember the testis is what produces the sperm, or it's chemically shut down. And when this happens, it can affect erection. It can affect your libido. You understand? A man that is castrated, erection, I don't think there's any erection even at all. It can affect libido. Why for vasectomy, it does not affect erection, does not affect libido. You perform your normal this thing as a man. Does not affect your muscularity, nothing. But in castration, it affects your muscularity, it affects your sexual drive, that's your libido. It reduces your sexual strength. So that is different between these two. So don't confuse it. Oh. So you need to understand the difference between vasectomy and castration. They are not the same. Oh. Some persons have this misconception that vasectomy is the same thing as castration. They are not the same. In castration, there is no production of sperm because the testis is removed. It's either surgically removed or chemically shut down. Why in vasectomy, the testis which produces the sperm is still intact. The body can still produce sperm, but the difference is that the tube that transport this sperm to the ejaculating duct where it is ejaculated out is surgically cut off. So when it's surgically cut off, there's no way sperm can transport now because the first difference, this major work is to transport sperm, not to produce sperm. So when this tube is cut off, when the tube is cut off, sperm will not be transported out. So the man will have normal erection, normal sexual urge, but even ejaculate semen, but just that sperm will not be there. And when there's no sperm, fertilization cannot happen. So that is what happened in vasectomy. So you need to know the difference between vasectomy and castration. They are not the same thing, no. They are not the same thing when it comes to birth control. Vasectomy and castration is not the same thing. Castration is where the testis is either surgically removed or chemically shut down, while vasectomy is where the tube that transport the sperm is cut off. You understand? It's cut off. So once it's cut off, sperm cannot be transported through the vas difference where it is ejaculated out.